Newsfirst, Newsline.
Hello there, a very good evening and welcome to another episode of Newsline Live, coming to you live and direct from our Newsfirst studios here in Colombo. Of course, if you're wondering why your usual host Farah Shaukatali is absent here today, it is because today is his birthday. So let me start off this program by wishing a very, very happy birthday to Farah Shaukatali, the host of Newsline Live. He is, of course, out somewhere doing his own thing on his birthday. Well, moving on to the show for tonight, we've been speaking about the safety of the food that we consume here in Sri Lanka. Now, this matter or this issue has taken new grounds, of course, with the revelations that there is a certain level of aflatoxin, a certain unhealthy level of aflatoxin that was found in a number of containers that were imported to Sri Lanka containing coconut oil. Then this argument or this matter grew and went into other food products as well. There was a stock of dal that was found containing aflatoxin, and then certain other food items also, certain groups claimed that they are unhealthy for human consumption, and also the statement made by a high-ranking official of the Sri Lanka Standards Institution. Now, with all of this information circulating among the general public, it is quite hard to make ends of what really is the situation on food safety here in Sri Lanka. Can we trust the food or can we consume the food? Is it healthy to consume the food that we purchase at our local grocery stores? So to make matters clear on all of this, we've got with us tonight the former president of the Sri Lanka Medical Association, Professor Indika Karunathilake. A very good evening, Professor, and welcome to the show.
Very good evening to you.
Professor, first things first, to just clear the water on this issue of aflatoxin being present in coconut oil. Now, there are some people who say that, of course not medical experts, but this is the general perception that people have. Having aflatoxin in coconut oil is carcinogenic, it's cancer causing, it's bad. But what really is the makeup of all of this? How does the percentage of aflatoxin in coconut oil really affect you? And does consumption of small amounts of this present in coconut oil really affect you?
Yes. So first, let's try to understand the basics. And this toxin is produced by a fungus called Aspergillus.
Right.
Actually, it can be present in many food items. Maybe coconut, like say dried coconut like copra, or even certain seeds, cashew nuts, or different kind of nuts, so on and so forth. What happens is, when the food items are in a cold environment, rather damp and cold environment, this fungus tend to grow on that.
Right.
And with that, it produces a certain toxin. And there are many types of aflatoxins, but there are some aflatoxins that can be harmful to the human body.
Right.
And it can be harmful in the short term as well as long term. For example, if you ingest a large amount of aflatoxin, it can lead to toxicity and can cause an immediate danger to the life. But then you are talking about rather large amount. On the other hand, if you take aflatoxin unknowingly in your food for a long time, then it can accumulate in your body and then can have harmful long-term effects. For example, it's known to be carcinogenic, especially to the liver.
Right.
And then there's a possibility of maybe genetic mutations, malformations. So all these possibilities are there as long-term adverse effects. So the most important thing is that the food safety is very important. Food safety, food regulation is very important.
Professor, of course, we all must be very careful with the statements that we make, because it is always open for interpretation. But one thing that the people, a main issue that the people are facing right now, and I know that because I too am personally facing these issues at home, because people, my parents, my loved ones, they all advise us not to eat too much of oily foods. I mean, I know this is a good piece of advice as far as your health goes and non-communicable diseases goes, but this piece of advice is specifically after the controversy that arose with the presence of aflatoxin in coconut oil. Many people are scared to consume items that have been fried in any form of coconut oil, although still investigations are ongoing as to if these stocks of coconut oil that contained aflatoxin have been released to the market. Is there any way that you could maybe advise the general public on how safe it is to consume items that have been fried in coconut oil or that has coconut oil as a component used in it in their everyday lives, at least for the coming month or so?
Okay, so it's a difficult question to answer. Again, let's go back to the basics. Like, actually speaking, there is no kind of minimal level per se. But in practical purposes, you can't really have a zero level of aflatoxin. You cannot guarantee that.
Right.
So, therefore, people are talking about the maximum possible level that could be available, and that is denoted generally in micrograms.
Right.
Micrograms per kilogram. Sometimes you would say particles per billion.
Right.
So there you are talking about very, very small amounts, say, and those amounts can vary from country to country. In Sri Lanka, the studies about finding out about aflatoxin levels is not a recent thing. Actually, from 1970s, because Sri Lanka has been a country that has been exporting coconut oil and coconut products, this has been an issue of concern, and it was important to maintain the acceptable level for importance.
Right.
So since 1970s, those studies have been going on in Sri Lanka. And in last year, in Sri Lanka Medical Association, when I was the president in 2020, there were a lot of discussions. Even before this concern and the current crisis came in, there were a lot of discussions about the presence of aflatoxins in coconut oil. And discussions were held with the Ministry of Health and the Coconut Development Authority, and with the collaboration of these three institutions. There were 5 criteria that were identified to certify the coconut oil that is safe to consume.
Right. So this is another standard certificate, like the SLS.
SLS certificate is also there. SLS certificate is also there. In addition to that, that's also included. There were 5 criteria that whether the coconut oil is adulterated, and whether it is rancid, what's the aflatoxin level, then the SLS ISO criteria. Like that, there were 5 areas, and based on those 5 areas, in 2020, a logo was designed.
Right.
And if certain production bottled coconut oil has passed those criteria, those certification was awarded to them. However, it started only in 2020. So I don't think most of the coconut oil
brands
that are bottled or brands in Sri Lanka, they have gone through this quality assurance and standard procedure. That's why I am always telling that it's very important. The most important thing is to strengthen the mechanism, or the regulatory mechanism. Again, getting back into those levels, they vary. The current safe levels that is stipulated in Sri Lanka is something like, say, up to 10 micrograms
per billion.
10 parts per billion.
Right.
10 to 15 parts per billion. 10 to 15 parts per billion. That is particles per billion or micrograms. And that also can vary from country to country. If you take the European Union, their regulations are very stringent. And their maximum level can be as low as 4 micrograms.
Right.
Or 4 particles per billion.
Right.
If you take United States, it's little bit more relaxed. They can go up to like 20 micrograms or 20 particles per billion.
Right.
Now you see the criteria has been changing, criteria has been varied. If you take the Food Act in Sri Lanka, there is 1987 Gazette, which mentioned about 30 micrograms. But again, mind you, that's long ago. That's about so many years ago. Fortunately, the current standards that are applicable to Sri Lanka are the standards practiced by Sri Lanka Standards Institute.
Right. So this is not going by the 1987 Gazette?
No, it
mentions 30 parts per billion.
No, that was there in the Gazette. That was about 25 years ago. But what is currently in practice in Sri Lanka?
35 years ago.
35 years ago, yeah. What is currently practiced in Sri Lanka are the SLA standards, which is in line with the European Union standards with the maximum of 10 micrograms.
Right.
So that is actually acceptable level.
Right.
So if a particular product has gone through those quality assurance procedure, then that's an indication to say that it is safe to consume.
So, Professor, if I also direct this question to you now, it is of course the duty not only of the government but of also the general public to make sure that they know what they are consuming, that they consume food that is safe for consumption. So when it comes to matters like coconut oil and the presence of aflatoxin in coconut oil, there is really no is there really no choice for the general public to make themselves sure or to be sure that there is this coconut oil in front of me is safe to consume? That is not a decision or a choice that or some information that a person individually can obtain.
You are very correct. I mean, exactly, because I mean, how can the general public know this the level of aflatoxin, whether it is more than 30 micrograms or whether
how can they test it?
How can they test it at home? And on the other hand, there is no guarantee that even homemade can have aflatoxin. Because I mean, if you like say local now, the current concern is about the import products.
There were opinions raised that if this situation continues, maybe we'll have to go back to the time where people produce their own coconut oil in their backyard.
All right. I mean, in the past, the coconut oil was produced at local production. Even now, it happens in the areas where the coconut is produced in large scale. But having said that, the traditional method of say using dried copra, that itself lead to the development of the aflatoxin there, because it happens. So there's no guarantee whether it is local or import that it is aflatoxin free.
There is always a risk.
Unless it has gone through the quality assurance procedure and the testing procedure. So
So Professor, if I'm to put this into context, now there has been an issue with a certain consignment of oil that has been imported from overseas, but that does not automatically mean that there is a guarantee of assurance for coconut oil that is produced locally. So really, what is the mechanism that should be put in place, or where is the loophole here?
Yeah, like I mentioned previously, now last year there was some attempt for the quality assurance using that logo, giving the 5-star certificate for the bottled coconut oil. So that kind of processes has to be strengthened. I think the way out is strengthening the food safety mechanisms and the regulation and also implementation. For example, strengthening laboratories so that more laboratories should be available. The process has to be streamlined, and then that once this certification process is available in a smooth and a streamlined way, because still this logo is available only for maybe few manufacturers, not for all. So others, there may be a possibility, there may not be a possibility. We don't know. There's no guarantee. So the most important thing from the regulatory authorities' point of view is to strengthen this mechanism. And also to be aware that even local production or even homemade production, there's no guarantee. I mean, especially if it is made with dried copra, then there's a possibility of getting it contaminated. But if it is made with, say, fresh coconut, like what you call the virgin coconut oil, then the possibility is less. But in this day and age, asking people to make their own coconut oil, I don't think that's a practical solution. It's always nice to have your own vegetables grown and then maybe your products. That's fine. That's really nice. It's nice as a hobby and good for your mental health. It's something good. But I don't think that would be
the answer to the issue.
Answer to this problem, because it is like declaring that the system has failed. You look after your own this thing.
Right. So nobody else is going to be responsible for your health and safety.
You look after your own. Yeah. Yeah, partly it may be correct. I mean, we should be responsible for our health. But as far as a system goes, the only way is to strengthen the regulatory mechanism, better laboratories, better facilities, and based on that, consumer awareness. The only way the consumers can identify that this is within safe limits is through the certification.
Professor, you also mentioned regulations. Now, besides the regulations, of course, based on health parameters that are declared by the Ministry of Health and other health authorities in Sri Lanka, it is also important to assure that offenders are brought to book and that they serve as an example not to breach these regulations. However, here in Sri Lanka, we have many outdated laws, the laws on food safety being one key among them. So even if an importer is found to have breached these regulations that have been put in place, that can have far-reaching consequences, even resulting in certain mutations coming in future generations as well. Professor, what really should we really upgrade these laws and regulations to bring these offenders to book and to make them an example for future importers?
I think so, definitely. I mean, it's all about, it again shows the importance that why we need to streamline and strengthen and update the mechanisms. That is where the main issue is. How to monitor them, say monitor at different levels, production level and even at the consumer level. So all these things, monitoring mechanism, then implementation, rules, regulation, they are very important, because now as you may see, the Food Act is 1980 and the Gazette regarding the aflatoxin levels for 1987. So
but however, through some other means, the Sri Lanka Standard Institution
fortunately, we are doing
kept in line with international standards.
Exactly. Because otherwise, you can't. Because the imports has to be, especially the imports of the European Union, has to be within those limits. So we have to. So it's good. I mean, because Sri Lanka has been a coconut producing country for a very long time, even though now we are importing. So it's good in that way. But still, having said that, the mechanisms, that's what we need to really strengthen.
Well, the first half of this show was dedicated to discussing the presence of aflatoxin levels in coconut oil and the controversy that has arisen in Sri Lanka after a certain consignment of coconut oil was found to contain high levels of aflatoxin. Of course, we must not forget that we are currently in the midst of the COVID-19 pandemic. Many scenes that you might witness when you go out on the street these days would prove to you that there is a certain level of complacency among the general public on this matter. And stay tuned to Newsline Live, because we will be discussing this issue and the possibility of another wave of COVID-19 in Sri Lanka after the commercial break with Professor Indika. Don't go anywhere. You're watching Newsline Live. Welcome back. You're watching Newsline Live. Just as we promised to you before the commercial break to speak about the COVID-19 situation in the country, Professor, let's start with a personal experience that I had. I visited a clothing store to obviously get some clothes for the new year, and I walked to the door. I saw that it was completely packed. There was no space whatsoever, let alone keeping a 1 meter distance according to the guidelines that have been issued. People were at each other's faces. It was a sight to see, especially since we are currently in the period of a COVID-19 pandemic here in Sri Lanka. And just last year, at this time, the entire country was on lockdown. People were suffering without food to eat. And at that time, we only had just a few cases coming a day, 1, 2, 3, 4, maybe 20 maximum. But now we have hundreds and hundreds of cases coming in per day, and people seem to have forgotten.
Yes, I mean, it's a concern, because we might think that the number of patients are going down. That also may not be the case, because now we can see another slow increase coming up.
Right.
So definitely this is not a situation that we can afford to be complacent. Definitely not. And having said that, I actually won't blame the people only. Because as time goes on, people have their own needs, and then the fatigue sets in, frustration sets in. So all these things might have led to the current situation, which is very disturbing. What I see is the priority. If you, the last year, the time that we have mentioned, I could remember we had a similar discussion exactly 1 year ago.
Exactly.
Yeah,
Professor.
and we were highlighting the need for the country to adhere to the health precautions, and people did that. The difference we can see is at that time the priorities, the country and the authorities and the government has taken this as a priority. The control of disease was a priority.
Right.
But right now, when you look at the development, it's a doubt that whether the control is it a priority, or do you want to make everything like normal? We are not talking about the new normal, but just normal, like it was. Yeah.
Pre-COVID-19.
Pre-COVID-19 normal. But we are talking about the new normal. So has the country really moved into a new normal where we will go ahead with the day-to-day activities while adhering to the safety precautions? That priority you can't see. So it's not only about the people or people's attitude, it's about setting priorities at different higher levels also, authoritative levels also.
Well, of course, we hope and pray that the authorities would consider this situation more seriously and make the control of COVID-19 a priority once again to ensure that we don't face another surge in cases, because already the PHI Association has warned of maybe another COVID-19 wave or an outbreak somewhere around May if the current situation or the current complacency continues.
Of course, let's hope so, because I think government has set an example last year during this time period.
We were one of the best countries that controlled COVID at the time.
Yeah, at that time, and at that time the patient numbers are very low, and the government has shown it by example and shown the priority. So I think
now it's a matter of just continuing that example.
Just continuing and identifying our priorities and getting back to what we have been doing correctly. I mean, it doesn't mean that getting the country into a lockdown, and that is, I mean, that was the time period that has gone. Now the strategies are different. Now it's a matter of moving into a new normal situation and establishing that. And
Professor, besides controlling the spread of the virus, now methods are present in the world to completely do away with this virus or to make sure that the people are safe. And I'm talking about the vaccines that have come. Certain consignments of vaccines did come into Sri Lanka. The government expeditiously distributed these vaccines among the general public, and now the general public are awaiting the second jab of these vaccines. However, there is a little bit of a concern over one vaccine that has been brought into Sri Lanka, as this vaccine has not yet been approved by the NMRA, but the consignment has been brought into Sri Lanka, and it is being distributed not among the Sri Lankan population but among the Chinese population. This is the Sinopharm vaccine. What is the story surrounding the Sinopharm vaccine, and why hasn't the NMRA still approved this specific vaccine?
Okay, so first shall we try to understand what is the role of NMRA and maybe a little bit about the vaccines?
Definitely,
also.
Professor.
Yes, yeah, like you correctly mentioned, vaccine is a very important tool in controlling this epidemic. Not the only tool, the most important is the adherence to the safety precautions, but a very important tool. And all these vaccines that have been developed and in use at the moment, what they do is they basically train the immune system of our body to identify the viral protein.
Right.
That the spiky kind of molecule, that structure that you see on the virus.
Right.
So that's the one that is really important when it comes to the virus adhering to our body cells and then spreading.
Attaching to the body cells.
Attacking to the body.
Right.
So that is where our immune system is trained to attack. So how these virus, ultimately what these vaccines do is they train our immune system to identify this viral protein component and attack it.
Right.
But different vaccines do it in different ways.
Right.
Yeah. Now if you take the Moderna and then the US vaccines,
right,
what they do is they get the protein to be produced within the body.
Right.
And similarly, the AstraZeneca also,
and Sputnik 5.
and the Sputnik again work in the same way. The mechanism is that the viral protein is produced within the body.
Right.
Once the vaccine is injected, and the immune system get trained. So in all these types, it's not the actual virus that is injected,
Right.
but a component that is capable of producing the protein.
Right.
In China, generally the way is little different.
What is the difference, Professor?
The difference is in the Chinese vaccines, both that there are 3 vaccines that have been used. It is the killed virus that is injected. So the killed virus obviously has the viral protein, and then the immune system identified that, and then the training happens.
So none of the other vaccines injects into the body of a person the killed virus.
Yeah. So, but I'm not telling that's bad thing. I mean,
that's another method.
That's another method of producing vaccines. It's acceptable method of producing vaccines.
But then, Professor, why hasn't this vaccine gotten approval from the NMRA?
Okay. Now, NMRA is the national body to regulate the medicine. That means the registration, recognition, approval, importation. So all these aspects take place only after NMRA or the National Medicine and Drug Regulatory Authority approval. And that is important because it's a matter of, say, our health.
Exactly.
Yeah, our lives. So therefore, it's very important that the drugs that are brought to Sri Lanka go through a proper safe approval process.
Right.
More so because they are not produced in Sri Lanka.
Right.
We are importing. So we have to rely on the evidence available. So what NMRA does is going through these documents or the safety evidence, and based on these and based on the criteria, they approve. So that's the essential requirement, because without that precaution, there is no guarantee about safety.
Right.
And when it comes to vaccines, it's even more important. And especially when you are talking about, say, a killed virus vaccine, again, I'm not telling it's bad, but then the safety becomes even more paramount importance, because when you are producing the killed virus in large scale, then the safety is very, very important due to obvious reasons.
And of course, this is still a novel virus, and
we don't know much about it. The country,
even after extensive studies, not only Sri Lanka but even the global community still doesn't have a 100% understanding on the makeup and functions of this virus.
No, even regarding vaccines, same about the vaccines. Say AstraZeneca vaccine also, there were some concerns. But again, what the research shows is, even though there may be a risk, the benefit far outweigh the risk. That's what authorities say. So we have to go by what authorities say. We have to go by the official documents and the research evidence that is available.
And there hasn't been adequate research evidence presented to the NMRA on this specific vaccine?
That was the reason that they have declined to approve, that they didn't have adequate documents to go through.
Right.
Not because any adverse effect or any report or anything like that, but they didn't have the document.
Because they can't guarantee the safety of this vaccine.
Because the only way that they can guarantee is to go through the official documents.
And by examining the documents.
By examining the documents. And apparently most of the documents are in Chinese language, and they are being translated. And that's the very reason that WHO also yet to identify this vaccine.
Right.
Because documents are yet to be made available.
Thank you very much, Professor Indika, for joining us on our show and clarifying, of course, these matters of national importance, especially on the coconut oil issue, because it's the New Year season and people have not been able to celebrate the New Year properly during the last year. And with all this tension and the stress that we have been through, it is only right that the general public are given a fair chance to celebrate their New Year and to celebrate it with peace of mind, knowing that they are consuming food that is safe for consumption. Thank you very much, Professor Indika, for joining us on our show. Unfortunately, we have come to an end in the time that has been allotted to us. There's much more to discuss. We will, of course, have you on one of our other shows again on Newsline Live. Thank you very much also to all our viewers out there for tuning in to Newsline Live. And once again, before we leave,